We are back on Morning Line. Thanks for joining us this Thursday. Dr. Mark Denison is joining us from over at Vanderbilt, professor of pathology, microbiology, and immunology there. Sir, thank you again for being here. If you would, just as an expert on the coronavirus and the like, and just to clarify, some people online and some calls coming in again saying, well, again, it's just, I can't believe I'm still hearing this, but some people are still saying, it's just like the flu, no biggie. Can you clarify that for people?
Well, the difference in the flu, number one is I've never understood that. It's like saying this virus is like a tsunami, so we should ignore the tornado.
Right.
It is an odd argument to me when flu can be so lethal and so detrimental, particularly to the elderly or those who are immunocompromised or those who are at risk. Ironically, not ironically, but an interesting side note is that here and other places around the world, and now in the southern hemisphere, it's been noticed that seasonal diseases like flu are at their all-time low and are absolutely going away when people practice social distancing. And so, there's that issue. The other issue with flu and this virus, before I talk about the coronavirus, the other issue is those of us who are infectious disease specialists, I'm actually a pediatrician in pediatric infectious diseases. That's my primary appointment here at Vanderbilt, is that we're very worried about what's going to happen if flu comes around at the same time this fall, and if people don't get their flu shots. So I'd say that the exceptionally important thing that we know works that you can do is get a flu shot, because then there's not going to be some confusion if you come down with a febrile illness, with fever or other illness, because and we also don't know whether it's possible that people can get flu and COVID at the same time. And if we see how bad these diseases are separately, the concept of getting them at the same time to me is fairly dramatic and draconian. I wouldn't want to see that. Second, I think the concept of this just being another virus is like, well, I guess if we take a Darwinian approach and we're happy with just this sweeping through, and in some cases in nursing facilities or senior facilities having up to 30% mortality, sure, it's just like the flu. Let's not worry about it. But I think that is not a human response to a brand new virus where 7.5 billion people are susceptible. If there's really been, if we've had 3.5 million diseases in this country, let's say there's 10 times that many that haven't been noticed. So let's say there's 30 million. Well, our population of the U.S. is about 350 million. So that's less than 10% of people who have had this infection. So I think that puts in perspective that this is not just your mom and pop cold virus, and that we cannot be selfish and take our own personal motivations into account when we're trying to not only protect those we love and ourselves, but our whole community, our whole population, and our whole country.
What is it, again, as you said, it manifests itself in different ways, the flu and this virus as it adapts and as it attacks people. Why is it that it, obviously has a different effect on some than others? As we well know, there's just some horrible cases where there's fatalities, where they're on ventilators in the hospital, and then there's many others who, are asymptomatic or just have a mild cough for a few days and get better. What is the difference? Is that because of individuals' genetic makeup, or perhaps the level of exposure, and maybe you get a mild case of it as opposed to a bad case of it, if that exists?
All of the above, I think, and potentially 10 or 20 other factors. And right now we have to call these hypotheses, because this virus is exploring human biology. It might have to do with if you get one virus particle in your nose and you have time to mount an immune response, maybe you don't get ill. We know that if you took measles virus and you put it on an island where no one, adults or children, had disease, you typically will get normal measles in kids. But if you but the adults got it, they would get profoundly ill and significant mortality associated with that. So I think that this is an example of basically where we try to keep thinking of this as if it's just another virus that's been around forever. It's new. And so the kinds of systems it's exploring, the biology it's exploring, is all new. So could it be genetics? Yes, but usually that's primary genetics. Probably not something about that. It doesn't appear to be targeting different groups of people differentially. We are seeing almost no disease in children, which we're very, very grateful for. Very limited disease, but not none, and sometimes very serious and lethal disease in children. So we can't ignore that. So I think the most important thing right now is to get across the idea that you can't make assumptions because you're 20 or 15 or 30 or 40 that, hey, this is not going to be a big deal. And in fact, we're seeing late complications afterwards that haven't yet been explained to, sometimes neurological, sometimes aches and pains and profound prolonged fatigue or cough, sometimes recurrences of some of the illnesses later in infection like fever. So this is not a benign disease at the population level, and you're playing the lottery if you think that you don't have risk because you're a certain age group.
You mentioned earlier the idea, which I don't even like bringing this up because it's more depressing, but the cold and flu season as it comes about, hopefully we have to address this. But you're right, we don't know. I mean, it could be possible that someone gets the flu and COVID-19, and that combination is kind of scary, isn't it? That's why I would imagine one reason, as usual, you would recommend people make sure they get their annual flu vaccines.
Even more than ever, I recommend it because that is something you can do something about, and you can make a difference, and you can protect yourself and those around you. So I'm a scientist and I'm a physician. I've been working on this virus family for over 30 years. We've been working on drugs. The drug remdesivir, all the preclinical work before it got into humans was done in my laboratory. So we have been predicting this, and we've been looking at this. I don't want people to be depressed. I want them to have the honest facts about the virus, about its biology, and about the science, and the fact that we can make significant differences just by our behavior right now. I won't leave my house without a mask. I won't let people come in social distance. My lab and my people are all spread out in 8 different laboratories, and we meet by Zoom, even though we're in the same hallway working on this virus. We talk about our families and our connections and where we've gone and what we're doing, because we can't afford to have our work shut down by the actions of others.
Gotcha. Hey, listen, we have a phone call here from Jason who's been waiting, and we'll go to Jason. Jason, good morning. Do you have a question for the doctor?
Yeah, thank you so much for taking my call. My question is, and I'll make this real quick. I took my son to the Vanderbilt Children's ER because he had did something to his finger. But when I was in there, I was asking the nurse about the COVID-related situations with children, and she said to don't believe everything I hear, but there are children in there sick because of that. But they always downgrade that, especially the president. I'm not going political here, but they're downgrading it and basically trying to hurry up and get these kids back to school. So I'm hearing mixed stories, about this, and I just wanted you to clarify that. Thank you so much.
To piggyback on
Sure.
that, Doctor, there was that story out of a county in Texas you may have heard where more than 50 infants had tested positive for COVID. I forget, it was somewhere in southern Texas. So there are cases, but go ahead and elaborate on that.
So thank you for that question. That's a great question. Nationally and here in Nashville, there are children who are getting ill from this. The vast, vast, vast majority are not getting significantly ill, but they may still function as spreaders of disease to other people who are much more susceptible. We're very, as pediatricians and infectious disease people, we're very grateful that this has not been so serious in children overall. But there are a couple things. Number one is it's unpredictable, and there have been nationally and around the world serious and lethal disease in children, just like in adults. So they're not immune to it. They can't resist it. There's nothing special about kids that we understand keeps them from getting the infection, but they are less likely to get seriously ill. Now, on the other hand, there's another disease that's an inflammatory disease that shows up after kids have had it, and we're seeing more of that around the country too, where their blood vessels get inflamed, their heart gets involved, and that can be treated if it's recognized early, but that's a complication of the disease. So children are not liberated from this, and I'm nervous about any reopenings that don't take into account the need to pay attention to trying to prevent transmission of this infection and protecting children and protecting them from getting infected and taking it home to their families and those that may be more susceptible.
And that's where it comes down to. Right now, as you well know, an awful lot of parents from K through 12, even for their college-age students, are trying to decide what they want to do, regardless of what the schools decide to do, what they want to do, that parent with their child. And so most of the schools we're hearing now are suggesting, if they do have classes, they'll social distance and the kids to wear masks. I guess that's one, to try to prevent them from getting the infection, not so much necessarily because it could make them sick, though it could, but to keep them from spreading it if they're asymptomatic and take it home with them to grandma.
Yes, I think both. We obviously don't want kids to get sick, and we can't predict who'll be at risk. And remember, in our population of children, there's also children who may have other underlying diseases, right, or underlying risk factors, and we don't yet know exactly how those impact them. We would assume that people who are immunocompromised or might be on drugs for other diseases might be at more risk. We don't know that, but it's something we have to take into account.
Before we take our next break, I wanted you to clarify this again for some of the people maybe just joining us with regard to a vaccine and asking, well, is the coronavirus in the vaccine? Like any vaccine, doctor, as you said before, what's in there is nothing live, meaning this vaccine's been dead, but there's enough of its genetic material that your body can recognize it even though it's not making it sick and build antibodies against it. Is that how that works?
That's right. This just takes a piece of the virus. If you've seen those pictures of the coronavirus with those spikes on its surface, those red spikes, that picture everybody sees, that spike is the protein that binds to our cells, gets the virus into the cells, and it's the one that we have to have immunity to prevent the virus. So they basically are just taking that spike protein off the surface and expressing it in different ways in our bodies. Now, you can get reactions to vaccines. And in fact, some people will get a sore arm. Some people might get a mild low-grade fever. Some people might get some aches and pains. Personally, from my perspective, I consider those to be positive reactions because my opinion is sometimes when I have that kind of reaction, that means the vaccine is reactogenic and I'm going to get a stronger immune response. So I've never seen those kinds of normal vaccine reactions as being something that I'm concerned about at all. And the trials are designed to prevent any serious reactions and to not give those vaccines either at that dose or that particular vaccine if they're causing serious reactions.
Okay, so just to clarify again, so what you're saying is the answer to their question is yes, a piece of the genetic material of COVID-19 is in the vaccine, but it is dead, it is inactive, but it's enough so your body can see it and say, well, this is what we'll need to build antibody-wise to protect ourselves.
And it can't infect a cell, it can't kill a cell, it can't cause disease, and it can't spread. There's no virus there.
As far as the question of spread in the asymptomatic patients, when we say that, and again, I know this has been reported, but I love it when I have a doctor of your expertise on just to cover this for some of our viewers and me as well. If you're asymptomatic, that means, okay, you have the virus, you don't know it, you have none of the symptoms. What, it's just hanging around for fun? I mean, how does that work? And then at that point, it's there, and so if you sneeze because you have allergies and you're asymptomatic, you're also sneezing out COVID, which could get to someone else?
Yes. Or you rub your nose and you touch some surface and someone else touches that surface. I mean, there's different ways that can happen. Airborne may be a limited way that it happens. Close contact with big particles is another way. That's the kind of thing that masks are particularly effective at blocking, either from us or someone else or from someone else to us. So that is exactly right. That is how it would work. Why people are asymptomatic, we don't understand. It probably has to do with the fact that their immune system doesn't fight the virus very hard, and the virus hangs around for a while but doesn't cause disease because our immune system isn't kicking in and trying to get rid of it. So I think we don't understand asymptomatic disease completely yet, but we know that virus can spread from asymptomatic.
Is it your belief that there are a lot more people out there possibly who are asymptomatic than we really predict right now? I mean, that could be driving the spread?
Yeah, I mean, the numbers that people generally tout is up to 10 times as many people. I don't know that that's ultimately a bad thing if it leads to significant population immunity, which would decrease or limit the spread. But it's a bad thing in terms of our at-risk populations right now, and the fact that we're still seeing increases in the number of people hospitalized and in the ICUs around the country and in Nashville.
You know, I wonder, because of what I do, and we try to separate here at News Channel 5 like you do at your office there with your staffers, but, I still come into contact even though I'm wearing masks, and, I try not to, but I scratch my face sometimes, like an idiot, but I do. How often do you think it's worth going to get tested? I've been tested once, not because I felt I had any symptoms, but I wanted to see what it was like, and it had been, I hadn't had one. I thought, well, I better check and see if I'm asymptomatic. Of course, I came back negative, but right after that test, anything that happens after that test, you could be exposed the very next day, right? So what do you suggest for people?
I think that's probably, I don't suggest that. I don't suggest that in general terms.
Okay.
I think it depends on the level of concern about potential exposure. That won't help us. Like you said, the next day you could have an exposure. The other thing is not all tests. The tests are very good, but they're not perfect, right? So they could sometimes give a false sense of assurity if you had a low level of virus or you had just started being infected and it wasn't detected yet. So I do not I don't think that's recommended from a public health perspective to do that kind of testing. Some people are doing that if they're having to travel or they're being with groups of people, particularly if they're going to see parents or someone in a facility that they may think is very vulnerable. Some places, like other countries, are now requiring, if you want to come there from the U.S., you have to have a test within 72 hours showing that you weren't positive before you can enter the country. So there'll be reasons for doing that, but I don't recommend it for just general, mine or yours, general anxiety. I feel the same way you do about my daily interactions, and we have to live our lives. We cannot completely ignore our lives.
Okay, good advice. Before we let you go, let's take one more call. We'll go to Tom. Are you there, Tom?
Hey, Nick. Good morning. How you doing?
Good. What's your question, Tom?
Well, Nick, we spoke before, and I have one lung, and I have pulmonary fibrosis started in the other one. So I'm very, very high risk in that point of getting it. But I'm fortunate I live out in the country where I'm not really exposed to much of it. We have a few cases around, but I stay quarantined on my little farm, you know what I'm saying?
Good for you. You should. Good for you. I'll say this, Doc. I wear a mask, yes, to some degree for myself, but for people like Tom. Because if Tom gets it, based on his condition, you probably understand it better than I do, it'll probably kill him.
I don't know that for sure, but Tom, thank you for sharing that. I think that you are one of the reasons that we are a community. We're not just individuals, and we have to, number one, control our own behavior. Number two, be very cognizant of folks like you who may have risk factors that might make it more serious for them. That we have a responsibility, not just to ourselves, but to all of those around us, and in those kind of behaviors to really help protect the most vulnerable among us, whether those are young or old or people with lung disease. And that's our goal, is to get through this all together.
Just to wrap this up, last question for you. I like to end on something of an upspin, and you come across as so credible and professional with this. But I mean, is it your belief? Who knows how long it may take, but there's going to be a light at the end of the tunnel. And for me, I look at places like New York City. We know what works, and if we do that, my belief is, we all can get a little depressed, a little manic over this stuff. But if we do it, we know we can beat this, right?
Yeah, yes. I think the tools we have now and the capacity and the response from scientists around the country, led by Dr. Fauci and others, are spectacular. And we can beat this. Ironically, we do have the tools right now to bring this under control. If we can depoliticize this and we can understand that it's a foreign invader. It's not. Mm-hmm. It's not us causing this. It's a foreign invader, and that we have the tools to do it. I think we can get this under control. Absolutely.
Dr. Denison, thank you so much for joining us. I really, really do appreciate your time, and maybe we can talk again. But thank you, sir, and keep up the great work.
It's my pleasure. Thank you for having me on today.
Thank you, sir. We'll take a break. Be back with another segment. Quickly looking at some of the questions and comments as we wrap things up right after this.